All right. Hello, everybody online at the Facebook audience, YouTube. We have an incredibly important conversation today where we're talking to leaders in southeastern Wisconsin about what the future is going to look like as we tackle the largest pandemic the United States has faced since 1918. And so we've got folks here on the call ranging from Dr. Tom Nicolai, who's a surgeon in Burlington and was served 9 years in the United States Navy. We have Joel Jacobsen, who is also a Burlington guy. He's an alderman on the city council with private sector experience ranging from insurance, real estate, and hospitality. And Joel has his education from the UW system with a finance and economics and finance. And he is running for assembly against Assembly Speaker Robin Vos in the 63rd District. We're fortunate to have August Schutz on the call today, who is a Racine County native, who is running for assembly in the 62nd District. August is an alum of the University of Minnesota with a degree in agricultural and food business management with a minor in business law. August has experience in the Minnesota State Senate, but wanted to come back to Wisconsin to make a difference in his home state. And we have the next congressman from the 1st Congressional District here with us today, a Racine native, UW-Madison and Georgetown Law School graduate who served as a civilian intelligence officer and a senior policy advisor in both the Bush and Obama administrations, addressing the spread of terrorist groups Al-Qaeda and the Taliban. As an attorney, he focused on public international law and investigations, and we are so fortunate to have Roger Polack on the call with us today. So the conversation that we have today is going to focus on COVID-19. As we know, the total confirmed cases today of COVID-19 is 8.1 million people. That is a 5% increase from 7 days ago. And so we're seeing this as a dramatic spread throughout the United States and throughout the state of Wisconsin. Wisconsin is actually trending 5th in the entire nation with 16,000 new cases in the last 7 days. So here to provide a little more context about COVID-19 and the spread and its impact on the state of Wisconsin in terms of public health is Dr. Tom Nicolai. Tom? Oh, Tom, you're muted.
There we go. There we go. I'm unmuted now. I'm an orthopedic surgeon, was practiced in Burlington for 31 years, and am about to retire in December. I've lived in Kenosha most of my life, other than the 9 years I was in the Navy and the 31 years that I lived in Burlington. But I've kind of been a southeastern Wisconsin guy the whole time. Went to medical school in Milwaukee and trained in orthopedic surgery in the Navy at Bethesda Naval Hospital. COVID-19, I kind of got interested in the politics of this virus in Wisconsin when I was asked about 10, 11 weeks ago to join some nurses in discussion of this issue with Robin Vos. He has sort of skirted any discussion of this, except for this one time when he was sort of painted into a corner by his constituents and asked to at least come and talk about the possibility of doing something for the Healthcare Heroes Act. So we met with him for about an hour at the Charcoal Grill in Burlington about 10 weeks ago, and I had a discussion about the 3 main areas that the Healthcare Heroes Act covers. Now, the first one is hazard pay for nurses who are at risk, and not just nurses, but healthcare workers in general. So the people who clean the beds and the people who, empty the garbage and the people who serve the meals. So that entire, broad healthcare worker field would be covered by hazard pay. I don't know that it covered dentists. I don't know that it covered dental hygienists. I don't know that it covered teachers, but it did cover healthcare workers. Now, interestingly enough, they were culled out of the hazard pay bill in April when the Assembly did a special session to discuss the CARES Act. And the reason they were culled out was because the people thought that they were not necessarily at more risk than anybody else to get COVID. And that in fact, if they covered them with workers' comp, they'd have no way of knowing whether or not they got COVID from their family or the community as opposed to work. They left the EMTs in there. So EMTs have COVID coverage, basically. They get hazard pay, I think, but I know they're covered for workers' comp. So if they get COVID, they get some coverage when they get some short-term disability when they're off work. And if they have sequelae, which about 10% of people do, they have some workers' comp disability coverage to cover that. Nurses don't get that, and nurses are one thing. I mean, nurses make enough money that they at least have the possibility of carrying disability policies on their own. The people who clean the beds don't, and they make $15 an hour. So they get COVID and are off for 4 weeks. They use their paid time off and their vacation, before they go back to work. And then if they have long-term sequelae, it's like tough beans. That's the break that you got. So live with it. And at the time we talked to Robin about that specific coverage, the first thing he says, well, that's not true. He said I run a business. He said, and my people, if they get COVID, he said they get 2 weeks, or if they're exposed to COVID, he said they get 2 weeks of paid leave to be in quarantine. I said, that's interesting. I said, because, I knew a nurse worked in the ER and just came down with COVID at the same time, or shortly before that, who was off work for 4 weeks, using her PTO. And I said, listen, I don't think we're talking about the same thing. I said, I think you're talking about, coverage for when you're on quarantine, and we're talking about what you do when you have the damn disease. So he kind of agreed, that maybe that he maybe misunderstood it, and that maybe the nurses should get some workers' comp coverage, and that he said that I would be willing to discuss this in a special session this year. And that's cool. I said, well, when are you going to do it? He said, well, after the election. There was an election at that time was 10 weeks away. There were 175,000 people in the country dead of COVID. Right? And this was before the Woodward tapes, so none of us knew that Trump knew all about this and lied about it for the first first month and a half before we even died. And but we did know that the Republicans in Wisconsin had done everything possible to obstruct Evers at every turn with respect to the response to COVID. So they brought lawsuits. They had done everything possible to stop him. But anyway, I said, that's great. I said, why don't you do a special session? You did one in April. I said, you did one. You've done them before. I said, why not do one? Get them there to at least discuss this. And maybe you don't have all three provisions of it, but you have maybe one that matters. And so I said, we can't do that. And I said, why not? Because there are elections. So we could do it after the election. That's interesting, I said, because 10 weeks, I said, 10 weeks, the way this rate was going at that time, because it looked like it had plateaued a little. But I said, I would estimate, I said, and you can tell me if I'm wrong, I said, but I would think maybe another 100,000 people will die in that 10-week period of time. And you're exposing your constituents and your state people to this virus with no protection for those 10 weeks. And I don't think that's right. And so, well, he said, really can't do anything about it. Can't do it till after the election. And so, well, you've done special sessions before. I said you did a lame duck one to strip Evers of some of his powers. And he said, well, that was different. That was after the election. That was, so in any event, that was where we left it with respect to the workers' comp type coverage for COVID. Now, the other two provisions of the Healthcare Heroes Act, the first one deals with hazard pay. And hazard pay is controversial because everybody wants hazard pay. As popcorn workers want hazard pay. The people in the grocery stores and at Walmart and the gas stations, everybody wants hazard pay. All righty. So he said that's controversial to start with. He said, we really don't want to do that. He said, but there's no money to do it anyway. And I said, well, what about the money that you would get with the ACA expansion of Medicare or Medicaid? And he said, well, he said, the ACA, and he literally said, the ACA is settled law in the land. He said, we agree with that. He said, but we don't agree with Medicaid expansion because, said, the hospitals don't like Medicaid because it doesn't pay very much. And the doctors don't like they don't like Medicaid because it doesn't pay them very much. And so we'd rather not expand Medicaid. So I think people have better options for healthcare insurance than Medicaid if they would just work harder at finding them. So I said, in response to that, I said, well, that's interesting. I said, would you argue, I said, that maybe 10 people in Wisconsin might have health care from Medicaid that didn't have any other option other than Medicaid? And I said, well, maybe. I said, well, I think that would be a good thing. And then I said, I've been a doctor for 40 years. I said, 40 of those years, basically, maybe with the exception of 2 or 3, I worked for organizations that didn't care how you paid. Okay. I worked in the Navy, and we didn't even bill in the Navy, just took care of patients. And when I came in private practice, I was lucky enough to join a multi-specialty group, and then we merged into Aurora Healthcare. Basically, I worked for larger organizations that paid me a little less money, but I had a little better lifestyle, and I also didn't have to worry about my patients because Aurora Healthcare blended their collections, and so did the Burlington Clinic. Right. So that I get paid on a work unit basis. I did a unit of work. They paid me X amount of dollars for that unit of work. And then they took they blended it. And usually, we collect about 50% from Medicare and maybe 5 to 10% from Medicaid. And, there are other private insurances. And bottom line is at the end of the day, they pay some money, and it turns out to be a substantial amount of money. I mean, there's not a one of us that isn't, financially well off. I don't care. There's some pediatricians that have a hard time, especially when they made them take their own write-offs, and all their patients are Medicaid patients. So pediatricians and obstetricians, were really hurt during the 3 or 4 years when Aurora made us take our Medicaid separate from our regular insurance coverage.
Right.
But when he did away with that for the last 15 years, maybe 10 to 15 years, it doesn't matter who you take care of. And I had patients, that I would take care of who had no insurance that I, needed to do like a total hip on, and they would eventually get Medicaid, and then I'd be able to do the total hip. They'd be able to get rehab. They got taken care of already.
So Tom, I do want to say that you hit the nail on the head when you're talking about the experience of healthcare workers and their role in making sure that they provide services to patients, which is a great segue to asking Joel his first question, which is frontline medical workers have put their lives on the line to ensure those in need get the treatment necessary to survive COVID-19 once diagnosed. Joel, many nurses and others in the profession have themselves lost the battle with COVID-19 or are still living with the lingering health impacts. So in your opinion, Joel, what should the state of Wisconsin do to take care of our frontline medical workers during this challenging time? I know the doc mentioned the HEROES Act. I'd love to hear your perspective.
Well, the biggest frustration as we have looked at this scientifically and been warned by the epidemiologists globally. Of course, we watched this slow motion disaster coming from Italy way before this. And now we have reached the point in Wisconsin, we are one of the global hotspots. And you have frontline workers. My son's an anesthesiologist. His girlfriend's a PA. My mother was an RN, and they're at risk. They're at high risk to get the disease because they're working with it, especially those that are in those units. And what we've done in the state of Wisconsin, basically due to the inaction of our legislation, they haven't really met since April 15th, is that now we're watching these frontline workers having to deal with this, and they've been told many times that you're overrunning your healthcare system, which is what we heard since January or at least maybe March in Italy. This is the risk. You overrun the healthcare system, and we just need to go to a scientific way to deal with this. Listen to people like Dr. Fauci, John Hopkins, and treat this in an adult fashion, not in a purely political fashion. And that's where we're at right now. Well,
Joel, you said something that was pretty significant, and that is April 15th. And so that leads me to my next question for August, which is, many Republicans in the Assembly are saying that there is nothing that state government can do to curb the spread of COVID-19 and to address the impacts on the lives of Wisconsinites. What steps do you believe, August, state government should take to slow the spread of COVID-19 and support local businesses and our schools during these challenging times?
I think number one, we got to look at continuing with the mask mandate. I think the Republicans trying to go take it to the courts and try to get that overturned, I think that's a grave mistake. We've seen that masks do work. There are people that are arguing that they don't, and we're still seeing a rise in cases even though we have it. There's still many county executives, county sheriffs, police officers that aren't enforcing it. And what good is the mandate if no one's enforcing it? We got to make sure that we're listening to public health officials and actually taking what they're saying and implementing it on how to go about this better. There's kind of a correlation that you can see between states that have taken a good approach to this. Out east, out in Oregon, Washington was a massive hotspot at first, and now you don't ever hear about Washington when it comes to COVID-19 cases. You look at South Dakota, you look at North Dakota, you look at Wisconsin. All three of those have something in common, and that's inactivity by the legislature to actually do anything. When the governor of South Dakota said that they weren't going to enforce a mask mandate, we're going to shut down, you can see the troubling effects because now they're almost as hard hit as we are. And so we're one of the only states that doesn't have a COVID-19 plan. Overturning the stay-at-home order back in May did a poor job at kind of making people stay at home. And what it did was it kind of there was no assistance to businesses to safely open back up. It was kind of, and this also stems back to the federal level. I think the federal level, they could have done a lot better, provided more assistance to businesses impacted by COVID-19. And now with the failure on the federal level and the failure on the state level, we're kind of just letting businesses fight for their lives. And you're either given the opportunity to make sure that people are safe and not being open, or make money and help out your family. And so I think that we got to do something at the state level, whether that be keeping the mask mandates in place. I agree with the governor with the 25% mandate. And then we got to look at other ways because we are clearly our inactivity by the legislature hasn't worked. And so I think those are top ways that we're going to have to look at in order to get back to normal.
Thank you, August. I think you hit the nail on the head that it's not just a state issue, but a federal issue in terms of government taking action to help folks who are hurting. Roger, this is a good question for you. In the United States, more people have filed for unemployment during the Trump administration than actually voted for the president in 2016. So what do you believe is the role of the federal government in ensuring that the United States economy bounces back from this pandemic recession?
Thanks, Trevor, and thanks to you all for being here with us, to the guests out there. Sorry I had some technical difficulties at the top, but it's great to be here with all of you and with Joel and August and Tom and Trevor, amazing. So the role of the federal government is enormous in this, and it, I think, has the ability to, more so than state level, to right this ship economically. There are talks from Republicans and others that we need to keep a close eye on the deficit when we're looking at the federal government response. And to that, I say, after the Great Depression, during World War II, there wasn't a focus on the deficit. It's a focus on saving lives and getting our economy back on track. And that's what real leadership is about. And that's what we're missing right now. We need to focus on getting the money to the individuals and businesses who need it most. And on that same question of deficit, you look at the last 3 years under Donald Trump, deficit has grown at a greater clip than any other president. And that's not something people are talking about a lot, but that is a fact that, you can't have it both ways. You can't say you want to have fiscal responsibility, but also grow the deficit at a clip of 36% over the last 3 years. And then when it comes time to bail out individuals and small businesses for once, you balk at that. And so I'm absolutely for making sure that money gets in the hands of individuals. And I think the $600 per week additional stimulus to individuals who are unemployed right now is absolutely the way to do that, in addition to the $1,200 stimulus going out to individuals. And what we see from Republican side, and specifically my opponent Brian Stile, calls those provisions, the $600 per week, quote unquote, unfair. He actually said that. And what he is saying is that it's unfair for someone who is working to be making less money than someone who is unemployed because of those $600 per week stimulus. To that I say it's unfair that over 215,000 Americans are dead and millions more infected and millions unemployed. And by the grace of God, certain individuals have been able to keep their jobs. But it's a matter of what's going on here is individuals, working class individuals, are being pitted against individuals who are struggling to make ends meet. That's not where the real battle is. You know, that's just the smoke and mirrors to distract from what's happening right now. And what's happening is that there's a complete abdication of government to get money into the hands of the people that need it most. And so, you know, I'm for passing the HEROES Act. I think that should have been done at the Senate a long time ago. Again, Brian Stile voted against that twice now. He voted against the Families First Coronavirus Response Act, which was the first major coronavirus response bill to get sick leave passed for individuals, to get additional funding for testing. So there are a host of things that the federal government needs to do economically. I think it's very important that small businesses are not in the same queue as large corporations that happened in the first round of PPP funds. I think that is not the way to do it, because you had small businesses that were struggling, that were on the verge of closing or have closed just because they couldn't get that PPP money in time. And as August said, you know, you have small businesses now just sort of fighting for survival with no help coming from the federal government at this point. And we need to certainly right that. And I think there's clear legislation out there to do that. You know, and I'm hopeful that in these last couple of weeks, there seems to be renewed negotiations to get some form of relief passed. I'm hopeful that happens, but I know that the Senate seems to be bent on obstructing any effort to get that done.
Well, Roger, I really appreciate you sharing your perspective on unique legislative opportunities that could make a difference in the lives of Wisconsinites in the 1st Congressional District. And we know that the spread of this pandemic has impacted small businesses, from local barbers to restaurants. And the way that we get this under control is our personal behavior and making sure that we're abiding by CDC recommendations. So what would you say to folks about your own behavior in comparison to your opponents? Congressman Stile has attended, large rallies that the president has hosted, in the 1st Congressional District. How would your leadership be different by leading by example?
I think what you see, and thank you for that question, Trevor. I think you see, the way that I've handled this is going to events small, to the extent that I am doing in-person events. They're smaller affairs. Individuals are socially distancing. Everyone's wearing masks. And you contrast that, all you have to do is look at Brian Stile's social media account, and you see just last week, there's over 100 individuals packedly into a small area. That was a specific Stile event. And then, of course, there's the event in Janesville with thousands of individuals. And so he's encouraging individuals by his actions, encouraging individuals and his examples, encouraging individuals not to wear masks. And it totally flies in the face of public health guidance, and it's going to cost people's lives for sure.
Yeah, I think you hit the nail on the head when it comes to leading by example. And that's directly related to my next question for you, August, which is that statewide evidence suggests that Wisconsinites are not really making changes to their behavior like they should, even as public health officials have given those warnings. The state's hospitals are on the verge of overflowing, and more people are dying from the disease than any time since the beginning of this pandemic. August, you're a young leader. You are somebody who is a millennial who is talking to your peers. As a young leader, what message would you like to send to your fellow Wisconsinites, particularly young folks?
One, I would just like to say it's a group effort. We're all gonna have to do our part in order to get around this. I mean, just like you guys, I want the economy to go back to normal. I want life to go back to normal, but that's not gonna happen until we get COVID-19 under control. And if wearing a mask is the best way to stop it, then I think that's what we got to do. I mean, I don't like wearing masks. I mean, it's uncomfortable sometimes, but if in order to save someone else's life, I'm 100% for it. That's one thing. We just can't be selfish. We have to make sure that have everyone's best interest involved, and not just yourself. And so I think number one, we got to make sure that this is a group effort and we all wear our masks, and then we can start returning back to normal. The CDC director, Robert Redfield, came out and said the masks are more efficient than a potential COVID-19 vaccination right now. And so that just goes to show you that masks do work. And so we need to listen to that. Like I said before, we need to listen to the health experts and make sure that we wear our masks to prevent the spread of COVID-19.
Thank you, August. My next question is for you, Joel. This is a pointed question because I think it's important to create distinction between you and your opponent, Speaker of the Assembly, Robin Vos. Robin Vos has blamed the spread of COVID-19 on, quote, immigrant culture. He's delayed Assembly action, resulting in Wisconsin losing over $25 million in federal aid, and he's opposed Governor Evers every step of the way at taking steps to curb the spread of this deadly virus. This is all while accepting hundreds of thousands of dollars of COVID relief for his private business. So, Joel, my question to you is, what is your take on your opponent's actions? But more importantly, what would you do differently in the Assembly, and what way would you champion both the economy and public health after you're elected?
Well, I'd like to say that my opponent views everything through a political lens. And of course, he's a career politician, which I'm not. And it's been sort of a sales job to the electorate for a long time about, how wonderful taxes are and how wonderful private enterprise is. But when you get into a situation like COVID, which we all agree here needed a national federal response, which we didn't get. It was totally inept. And so when I think my opponent's misjudgment was when we had the April 7th election, he looked at it as some sort of way to gain political advantage and basically ended up exposing the entire state to an in-state election. And that has been, I think, an overstep on his part. And of course, now we haven't had any. It's been basically, we're going to try to discredit this governor rather than try to help Wisconsin people through this. And also, in some ways, it's sort of a mixed message, but half that message is go ahead, group up, have your businesses open your bars, and it's not going to work. And in reality, if we had paid attention federally and statewide, we would be in a much better position. The example I like to give is my daughter lives in Brisbane, Australia. The bars are open, COVID-free, because they listen to it. And so our economy would be in a much better situation as well. Could you repeat the second part of that question? Oh, what would I do? Well, I think it's kind of let's start reading between the lines. We have to change the legislature, and we need a change of the guard, because we aren't going to get on top of this until we get whatever side of the aisle you are. We've got to agree that the health and the economy of our state comes first. And the way to do that is you've got to, and hopefully the federal government will cooperate this as well, but we've got to get a unified response, scientific, keep explaining to people, and this would be an education as well. And we've touched on this, where it's not going away. And so you better start responding, and if you in a much more mature fashion to this, rather than the drama that we've seen coming out of this. So we need to change it, and we can use some education. I think we're going to give some businesses if you have stronger policies, you're going to give businesses the opportunity to just say, the state is the bad guy here. You can't come into my business without a mask, or you have to socially distance because the state tells me to. So they can blame it on the state, but it will also help those businesses be able to operate. And then we need to protect our workers, whether they're medical workers or in any of our other businesses. Certainly like meat packing has been affected. We've got deaths out of that. We need to make sure that those businesses and groupings, like the giant grouping up by Oshkosh, Lake Butte de Mort. I mean, it was thousands of people just all talking to each other's face, and we're wondering, well, how did we get to this situation? Well, you have to you have to do some more enforcement and education, and that's the only way we're going to solve it. Just one more comment. That was an epidemiologist, probably, I don't know, maybe June, and he said, "You're going to get hit by a 2x4 in the head. It's going to hit you once." And he says, by usually the third time, you finally start getting it, that you are going to, it's not going away. It doesn't care if you have a D or an R after your name. And that's regretfully what we're going to have to do.
Well, that's a big thing. I appreciate what you say about it doesn't have a D or an R next to the name. August, Joel, you both are in relatively, Republican districts, but are competitive this time around. How do you send that message to those folks who might not think about voting for a Democrat, but due to the circumstances are on the fence? What is your conversation like with those guys? Either one of you could take that.
Yeah, I'll take it first. People are sick and tired of politicians not listening to them. That's one thing we've seen over the years, and now with everything being so partisan, there's really no way for legislators to break from the GOP. And I think people are tired of that. People don't care what party you are. They want to see common sense. They want to see us listen to the health experts, and they want to see new leaders that are going to actually stand up to their party and work for the people of Wisconsin to make a better life. And so I think it's time for a change, and people are looking at that.
That's great, August. Joel, what is your message to traditionally Republican voters?
Well, I think that take a look at what's happened here. And I'll underscore what I just said. This is not going away. And unless you get a change of leadership and a change in the legislation, you're going to be stringing this COVID thing out for a long, long time. And for the long term, whether it's economically and for our health, we desperately have a change, because right now the current leaders of the legislation don't appear to be willing to change anything. They don't want to continue to play political games while our COVID numbers just jump through the roof. And you got to change it. And I will go into the legislation willing to work across the aisle for solutions that work. You want to change it in 2 years again, go back to Republican, great. But let's get this fixed, and we'll see where we can go from there.
So those are powerful insights from a political perspective. But as we know, there is no freezing time to stop the spread of this disease. And so even after we're all sworn in, you're all sworn in to your respective offices, you're going to have to take on the challenge of this spreading disease that has been totally ignored by leaders on the other side of the aisle. And there is a particular group of folks who have been hit more dramatically than any other group of people in the United States of America when it comes to the spread of COVID-19. And it's people of color, due to the disparities in health outcomes and inequalities that exist in our healthcare system and accessibility to that type of care. Roger, how can we make sure that no matter who you are, no matter where your zip code is, that you have access to quality care and that you're able to recover fully from any type of illness, not just COVID-19?
Yeah, hey, thanks for that, Trevor. It's a really important question, especially where we are right now as a nation. I think one of the most common sense ways is to expand the Affordable Care Act and have a public option that expands Medicare and make sure that we're able to get more individuals healthcare coverage. The Affordable Care Act insured an additional 22 million people in the United States that didn't have health insurance, but there are still 28 million Americans that lack health insurance. That's a staggering number. And there is a lot that can be done to bring that down. And I completely back the plan by Vice President Joe Biden to expand Medicare coverage. I think that would go a long way. Additionally, a lot of the disparities that we see between white America and Black America are related to wealth gap, and I think we need to do a lot of work to close that. And speaking with Black community leaders throughout southeastern Wisconsin, so something that I hear on a regular basis is, and this isn't directly related to healthcare, but it will play a role in that, is increasing home ownership and small business ownership amongst the Black community. Home ownership is the way that middle class America stores, accumulates, and passes on wealth. And that has been out of reach for too many Black Americans, and certainly in southeastern Wisconsin. And I know what it's like to grow up in a family that worries about paying rent and has throughout my childhood from 0 to 18. My family rented a duplex every month, throwing $600 out the window. That money not accumulated anywhere, and I know what it's like to grow up struggling. And if our family had been able to qualify for a loan and accumulate that wealth, that would have been a huge difference maker. And that has follow-on effects for access to health insurance. And I'm hopeful that once Medicare is expanded, the wealth gap plays less of a role in individuals' access to healthcare. But I think we absolutely need to tie these two things together. We need to expand healthcare, and we need to close the wealth gap between Black America and the rest of America.
That is powerful, and I think that it needs to be talked about more because it goes beyond one sector, and we need to make sure that everybody has a shot at the American dream. Now, I want to make sure that you have time just to maybe even ask each other some questions. If August, Joel, if you have any questions for Roger, or if anybody has questions for Tom, who is the resident doctor on the call. I have one question for you, Tom, and that is, we hear all of this discussion around, the politics of masks and everything like that, but you're a doctor, you're a surgeon. What are your conversations like to take the politics out of the science and just make sure folks follow the guidance of the CDC?
Well, I don't know what the question is. The CDC has been clear. Probably 55 to 60% of the population of this country believes them and follows those guidelines. And we have 35 to 40% of people who believe President Trump and his Republican enablers and apologists and just don't believe it. Okay, so you got a president running around the country, contagious probably. All right, he supposedly, if you believe the quote unquote doctor taking care of him, he's been tested negative for COVID, but they use the test that has a 30% false negative rate. They refuse to use the test that has a near 100% false or 100% positive rate. So we don't even know if the guy is spewing virus, and he's holding these super spreader events with people crammed in. He puts his security detail at risk. He puts the pilot of the Air Force One at risk. He puts at risk the stewards who serve his breakfast every morning and the people who clean up his bathroom. It's nauseating to me, his lack of regard for anybody else. But seriously, 35% of the electorate believes him, follows him, will do anything he says to do, and will vote for him. And to me, that's the most sobering, statistic in this whole election is the percentage of Americans who are, pick your label, but who follow this guy like lemmings off a cliff. And I think that, the Republican Party, his enablers, the Brian Stiles and Paul Ryans and Mitch McConnell's of the world, Ron Johnson's. Now I think he's going to hamstring the Republican Party, at least that wing of the Republican Party, for a generation. And as far as the Republican Party in general, it'll probably take him, 4 or 8 years to kind of recover and get, more reasonable centrists in party power. As I think Donald Trump, if he lives, which I think there's a probably 40% chance that he dies of this disease, being 74 and fat and having COVID and being short of breath. I mean, he's got a significant chance of dying. He has, I think, no chance of winning this election. And I think that he's got a decent chance of being indicted on any one of about 4 different charges. So I think he's disgraced or will be disgraced. I think he'll go down in history as the worst president we ever had. And I think that the people who enabled him, will see their political careers disappear. And hopefully, I've been a Republican most of my life. At least I've been an independent, but I've leaned right. I've voted Republican more than I've voted Democrat in my life. And I just, I don't know that I could ever vote for Republican again unless things really change drastically. And the fact that he just ignores the CDC, he's got really smart people in Fauci and Birx and the CDC people. And, the FDA is run by smart, intelligent people who will tell us when a vaccine is reasonable. And he touts, his working on the magic virus, the magic immunization being his. Luckily, we have 9 or 10 good pharmaceutical companies, running real live virus tests. And the Russians taught us something about these immunizations. I mean, they taught us that you can't cut a corner. So they came up with a way to do a virus without clinical tests, using experimental data as the underpinning for that. And they gave it to some people, and it didn't work, and it made them sick. And now they're not using that immunization, and they have, one of the highest rates of COVID in the world.
Right. Well, and that shows that leadership and responsible messaging from the top to folks who are paying attention is so important. And that's why I really appreciate, Joel, August, Roger, your voice in making sure that we're sharing the news about safe habits and also advocating for our communities that are most impacted by the spread of this disease, whether they be, folks who are on the front lines, medical workers like Joel has been an advocate for, or their mom and pop shops who had to close down because this disease went unchecked for so long. And so I want to give everybody about 30 seconds, Joel, August, and Roger, just to provide a concluding remark and a message to folks either in your district and throughout the state of Wisconsin. Roger, let's go.
You want me to go first? You want me to go first? Okay, so love hearing Dr. Nikolai's comments. He is one of those people that said, my party's changed. This is not the party of Eisenhower, especially. It's not even the party of Reagan. It has become totally dysfunctional, and it's at our state level too. We need a change. I'm willing to go into the legislature and do that. And so I look forward to, I'd love to hear from people on all sorts of questions, small business, etc. And I really look forward to receiving your vote. I can make some positive change.
Thanks, Joel. August.
Hi, everyone in Norway, Raymond, Caledonia, North Bay, Wind Point, and Racine as well. Communities in the 62nd. There is one candidate in the race that is going to actually put his foot down and try to get to work for the people of the district, try to get to stopping the spread of COVID-19. And then there's one that's just going to listen to his party, not do anything while the virus rapidly increases its cases. And there's a clear difference. One person's going to care about public health, and that's me. And I would love to have your support going forward. But thank you so much for having me today, Trevor. And thank you, Tom, Joel, and Roger for joining as well.
And Roger?
Hey, thank you, Trevor. And thanks to August, Joel, and Dr. Nikolai. I think it's a great conversation. And, we have an opportunity here as a district, all of southeastern Wisconsin to move forward. And I think stepping aside from the COVID specific conversation for a second, we have an opportunity here in southeastern Wisconsin to determine the course of who the next president is. My own campaign has run a poll showing that Trump and Biden were tied in this district as of July. And this is a district that Donald Trump won by 10% in 2016. And so we have a real responsibility here to get out and vote and make our voices heard, because as Southeastern Wisconsin goes, so goes the state of Wisconsin. And I mean, even Donald Trump said it, you know, as Wisconsin goes, so goes the country. So we have to do everything we can to make sure that we get out and vote blue down the line. And, you know, I'm going to be the candidate that is, and once elected, that cares, just like Joel and just like August, that cares about what public health officials have to say, taking this virus completely seriously, voting in favor of getting money to where it needs to go quickly, and certainly will never call stimulus to individuals who are out of work unfair. You know, that is the bottom line there. And please go to rogerforwisconsin.com to learn more about the campaign. And once again, thank you all for attending. And to those out there, vote by November 3rd, you know, make a plan and execute on it.
Roger, August, Joel, Tom, I really appreciate your time today. And there's a billboard in Kenosha County that says COVID is controlling the economy and Democrats will get control of COVID. And I think if there's one message today from this conversation, it's that. And so I thank everybody for listening at home. And we've got to get out and vote. We've got to get out and vote for Joe Biden and Democrats up and down the ballot. So thank you so much.